Well, thanks for joining everybody. We're going to get underway so we can be fully fully respectful of all of your time. Exciting to have my friend Dr. Samir Melki on the line with us today. He is um, Boy, we've talked a lot. We haven't had a chance to do any business together, but I know you work with a lot of our friends here at MJM and Practice Habits. And he's as good a surgeon as he is a businessman, and he's an excellent businessman. We met a few years ago, and we were meeting on one of his offerings called My Team, which he'll give a little bit of an overview on some of his offerings. But he is actually calling in today from Harvard Business School, where he's doing a class after this. And so we're in for a real treat, and I hope people realize the level of caliber of presenter we have, in sessions like this. So he's created not only My Team, which is a way to outsource some of the contact management pieces of your practice, and he does so with the group that he built in his home territory, but also he has laser vision correction, almost practice management or EHR solution that does everything from payment processing to holding patient data. That's called Samurai. But today, we're talking about one of his new offerings called How Did It Go? And all of these have been born out of his work at Boston Eye, Boston Vision, thank you, where he works, and he also does some adjunct work at Mass Eye and Ear, and is, like I already mentioned, doing work day to day at Harvard. So busy guy. I'm excited to learn from you about what you have created, and maybe Dr. Milky, you can just give us a little bit of an overview. We called today's session, how to reduce anxiety for patients, but we have practice administrators on this line. We've also got some friends from the business side of the practice who help support practices, much in the same way as some of your offerings do. And every week we get together and we talk about, how do we implement change? Because that inertia is real. And you've been working on that with several of your different offerings. And so maybe first, just give us a sense of those offerings, and then how do you tackle the notion of handling patient anxiety?
Thank you, Matt. Thank you for the invite. I love these kind of sessions. We learn a lot from each other, and
Hmm.
and I still take courses. And like last year, I took the Physician CEO course. 10 years ago, I took a course here at Harvard Business School, which was called Managing Healthcare Delivery. And out of these courses, some of these things came out of when you're discussing things with colleagues and friends. And so I founded Boston Vision in 2000, just myself and another technician. And this grew over the years to a 7 location practice. We do laser vision correction, cataract, and everything. So we have 2 laser centers in the Boston area. We have 3 office-based suites where we do cataract surgery and everything else. Um, in the last few years, I guess I got bored doing just managing 7 offices, so I decided to start doing other things, and this is how my team was born. Actually, not out of boredom, but my team was born out of the need because we couldn't find people to answer the phone. So we set up my team as a small call center for us in Beirut, Lebanon, where I grew up and where we know a lot of people speak good English. And when it worked for Boston Vision, we extended it to others. And now we have a team of about 150 people working with about 30 US practices. And we basically handle phones, everything that has to do with back office operation, handling leads, handling surgical scheduling, all sorts of things. And so that's been kind of a fun adventure, especially working with very enthusiastic, young, and energetic people. And on the software side, we have been developing something called Samurai, and Samurai is basically a software. At this point in time, it handles refractive surgery from A to Z. And not many people know about it because we did not roll it out, except for us and another practice. And we did not roll it out because we wanted it to be like really mint before it goes out. I don't want to put anything out that's not really as perfect as I want it to be, but we're pretty much ready for prime time. We'll be rolling it out soon. And there's pretty much no software out there that handles the refractive journey.
Hmm.
Um, and the fourth product, which I'll be talking about today, is how did it go? And I'll leave that for later in the discussion. I'll talk about it. So I'm going to focus more on what we all came for here today, which is um, reducing patient anxiety. So let me share my screen. All right. So as I was putting this talk together, uh, I was thinking, okay, well, let me make sure I didn't forget anything, and which brings the usual speaker anxiety, right? Like, did I forget something? Do I need to add something? So how do you reduce actually speaker anxiety before you reduce patient anxiety? What do you do? You go to ChatGPT and you're like, okay, what's the latest about reducing patient anxiety, in addition to the things that we are doing? And interestingly, ChatGPT came up with these five things. And ChatGPT said there are five strategies. One is that predictability beats reassurance. Two, visual familiarity before the day of the procedure in terms of how the procedure is done and everything. Authority plus empathy. Control through small choices. And I'll talk about these in a moment. And the most interesting one to me was number five, which was going to be the emphasis of my talk, which was social proof from people like me. And so what are the things that we are doing, and probably some of you are doing right now, is that we show pre-op videos, and we have spent quite a bit of time on these videos. Why? Because during COVID, we don't want to spend a lot of time in the room. So we said, okay, let's record our consult, and we will have the patient watch it, and then we'll walk into the room after that and for a quick, Q&A. And interestingly, we found that patients loved it. And so now what we do is that we send these videos ahead of time, or even in the clinic, we have them watch it again. And we had them like professionally made. And do you see my screen here? I'm jumping to a different screen.
Yes. Hmm.
Okay. So this is the video that we made for Boston
allow you
Vision.
to reach the goal of seeing without glasses or with very little glasses. I started Boston Vision in 2000 with the commitment to provide people the best technology and the best surgeons to give
So here we have
best possible option.
different
Come in
surgeons.
for an evaluation. The first thing we're going to do is we're going to look at the prescription of your previous contacts and glasses. We're going to recheck your prescription. We're going to do a full eye exam. Sometimes we dilate the eye depending on your specific situation.
Okay.
Right, so I'm not going to go through the whole video, but to show you that basically we go through that video to talk about the whole journey. And we have it for cataract, we have it for refractive, and we found that that helped quite a bit. The second thing that helped quite a bit in terms of visuals is that we make sure that the patients know who their counselor is, and we assign them a specific counselor. So when I'm sitting with a cataract patient, although all our counselors are remote, nobody is in the office, but I say, okay, this is Ariselda. She handles my patients. These are the numbers. This is how to reach her. And so that definitely reduces their anxiety in terms of knowing that there's one person that they can relate to, and that person owns their case. And if they have any issues, they don't tell me, I called, I left a message, nobody called me back, I don't know who to call. So that to me is an important thing that we do. The other thing that I think is important is also to give patients, I give them my cell phone number and I give them my email. I have always done that since I started my practice, especially for refractive patients. Some of my colleagues think they're crazy, you give your cell phone number, but in reality, very, very, very few patients really call my cell phone. And when they call it, I'm glad they did because it's important. So this is where authority and empathy comes into play, they need to feel that you really are there for them and you're accessible and you're available. And that's something that we emphasize, and all our doctors give their card with their email and their cell phone number. I get a lot of emails, although I don't get calls on my cell phone, but I get a lot of emails after consults, especially from cataract patients asking me further questions, clarifying which IOL, and I don't mind answering because that reduces their anxiety and makes them, make more informed choices. And number 4, which actually I didn't think of it this way. It's funny that ChatGPT thinks of it this way, as control through small choices. So you give patients the choices of doing certain things. So, like, would you like a weighted blanket? Would you like a warm blanket? One of the things that we do is we ask the patient if they want, what kind of music they want to listen to during the surgery. What kind of we have like lights in the room. What light do you like? A blue light, a yellow light? So by controlling these small choices, we help them reduce their anxiety level. So these are kind of the things that some of you probably do and that we have done over the years and that we have felt that they're helpful. But one of the things that we discovered is that we actually had students come from Harvard Business School here about, I don't know, 8 years ago, visit our office, and they wanted to do a study for their course. And they looked at all our patients, they interviewed everybody, they interviewed people at the business school, and they came back and they said, we think it'll be really important for you to connect patients who have not had surgery with patients who have had surgery. That will help a lot in terms of reducing, people's fears. And what they found out is that by talking to some of their colleagues who have had LASIK is that people are eager to share their experience. They really want to pay it forward to others and tell them, how things went. And this is how we created this platform called How Did It Go, where we connect patients before and after surgery. So those who have not had surgery with those who had surgery. And we discovered a few interesting things in the process. So this is the platform. It's called How Did It Go? And basically you go there and you will pick which procedure you want to read experiences from our patients. Is it LASIK? Is it PRK? Is it cataracts? And then you will go there and read those reviews. As you all know, we all know how important reviews are, and we all know how much begging we do to get reviews, right? We beg patients for reviews. We beg patients to we beg Google to take down bad reviews or unfair reviews, and we beg our staff to beg patients to post reviews. So with How Did It Go? We kind of changed the calculus in the sense that the outside reviews, Google, Yelp, all these, are really for lead generation. But when the patient arrives to your office, they don't look back at those reviews, they're already there. So what you really need is a conversion tool. And the conversion tool, this is where we found that How Did It Go helps, because it reduces patients' anxiety. They can read, they can filter by procedure. They're not reading a review about you as a person or the practice in general, but they're filtering by procedure. And now they're reading about ICL, they're reading about LAL, they're reading about, and beyond that, they can connect with these patients one-on-one. So they can have a one-on-one conversation, either by text or by video, on the platform itself. So that's something that would be rolling out very soon, and there'll be a free version for people to use. So basically, you have lead generation by the external reviews, and you have the internal How Did It Go ecosystem that generates internal reviews that at the same time feed back to your external reviews. Because what we found out is that when people write these reviews after they have the procedure, 30% of them, when we give them the option to do it, 30% of them will post it on Google. So in reality, it's a tool to not just improve conversion, but also to improve your leads, because you're feeding the external reviews at the same time. So why is this different? right? I don't know if any of you uses things like MD identity or anything like that. Usually when you send these texts to the patients to ask them to write a review for you, usually the response rate is about 3 to 4%. Okay, the response rate with How Did It Go is more than 90%. Why? Because one, we're not constrained by the rules of Google, meaning we can tell the patient, we can incentivize the patient. We can say, hey, if you share your experience, and what we say to the patient, be a helping voice, right? We don't tell them to go write necessarily a review. We tell them, be a helping voice. We want you to help other patients. And for that, we're gonna reward you with something. Whether it is a discount, whether it is a lifetime warranty, whether it is whatever works for your practice. And the most interesting thing that we found is that patients go in and they write these very long reviews. Like we counted the word count, and it's literally 5 times longer than Google. And the reason why is because they feel that they're writing this for their fellow patients. When they go on Google, they're writing it for you as a business. When they go here, they're writing it for the patients who are coming after them. And so this is why we decided to change the name from advisor to a helping voice. And then when they write their review, we ask them, would you like to copy this review and post it on Google? And like I said, about 30% of people will do that. And then they can filter by procedure, filter by language, by rating, and by date. Now, and if they want to, they can go and request a meeting with a particular patient, and they can have that conversation on the platform without having to disclose their phone number or anything. So this is where I'm showing that 30% will post on Google. So our experience has been tremendous with this. I mean, we've been using it for several years, and we have about 4,500 users on it. So we created kind of our own social network for patients to connect with each other. And at the same time, when you generate these reviews, it's going to help you with your ranking, with these AI engines. So if you go and ask ChatGPT, what matters for ChatGPT, right? What matters to you to rank me high? And they talking about reviews, they say reviews are a foundational input. And interestingly, they tell you, ChatGPT says detailed reviews are more important than 5 stars. Great place, 5 stars, right? They want detailed reviews. And so the reviews fuel mentions, and mentions are called for ChatGPT. So the difference really between How Did It Go and the external review system is that here you get your own URL, you own your reviews, you can remove any review that's unfair, inaccurate. The capture rate is very high, the review length is very long, and you can review by line of service, you can have one-on-one advice, and you can have a link, to your business and all sorts of other features. And so we're rolling this out as a free version, which was going to work for most people, which is you're going to be able to put like up to 3 lines of service on it and link to at least one external review. For people who want more, we probably going to charge something just so that we can keep this going. But we find this to have been like a really good concept for us, and I hope that soon others are going to be benefiting from this, especially in refractive surgery today, where you see the volumes not what they used to be. We're hoping that this is going to change the calculus a little bit for patients to reduce their fears, and when they come to you and they say, I heard all these stories on the internet, or I never heard of ICL. Well, go to How Did It Go and see all our ICL patients. You'll see like now, 50 or 100 of them, and then you'll feel much better reading about their experience.
Dr. Melki, a couple of questions. First of all, as you know already, I'm fascinated by the thought process, right? Because it does put existing patients in the driver's seat to be talking with existing prospects, and I think that one-to-one is extremely valuable as far as the authenticity of it. If you're talking to a practice who hasn't done this yet, at first I get overwhelmed because I'm thinking, boy, I have no idea how I would implement this. Well, give me the 30-second version of how you explain it, and
Mhm.
then the second 30-second version of how you implement it.
Sure. So one is so the 30-second version about how to explain it is on how did it go being a tool for conversion, while all the other reviews that you have right now is to generate leads. So how did it go is to improve your conversion, right? And how do I implement it? So this website can be set up for any practice in literally 15 minutes. You just go in and you say, put the name of the practice here, put the services that you offer, link, put some sort of an incentive for every patient for every one of these services, like LASIK is X, Botox is Y, this is that, right? And all of a sudden now the website comes up with all these services, right? And now how do I implement it from here on? So from here on, I need to recruit helping voices, right? So now I will make this part of my consult process. So when the patients come in, as you know, many of these patients ask for a discount. They ask for lifetime. They ask for something. And then you say, okay, well, we have this great program. Without it, it's X. With it, it's Y. And then I'm telling you, like more than 95% of patients say, yeah, I'll be happy to do it.
And
Actually,
what are the discounts that you're offering? So like they will opt into a lifetime kind of enhancement policy, a lifetime
right.
vision policy, or
For LASIK, this is what we do. I mean, we used to
sure, sure.
do it, and then for us, we said there. But now we're going to start implementing for other things, like for Botox. For example, we're going to say, okay, well, you get the next Botox for 50%, for example, or you
I
get IPL, you get one IPL free if you do this, or whatever. Okay, so you pick whatever works for you.
hmm
And patients, what we find out is that patients really don't necessarily do it. You don't have to even offer a discount. I mean,
hmm
I can tell you that many patients will do it because they just want to do it, right? And as long as you put it part of your consultation process, and from there we immediately send an email to the patient where they can sign up. And after surgery, we just remind them that, hey, you know, remember you have to leave a review or whatever. And that's pretty much it. Now, one thing that we thought about doing to jumpstart this for any practices who are with us is to go to their Google reviews that are existing right now, take a bunch of them that are good, where we can identify which procedure, put it on the platform, and ask the patient for permission to post these on it. So now automatically you jumpstarted this with a bunch of helping voices.
Got it. Now, with that, then, do the patients, do they actually reach out? Do the prospects actually reach out to past patients? Because of that, if you can enable that, that's extremely powerful.
Yes. So you give them the capability of doing these one-on-one. So what we're doing right now is we're saying you don't have to answer you don't have to do more than 3 consults. Once you do 3 consults, that's it. You fulfilled your obligation.
Hmm
And more than that, we're saying if you upload your picture on the profile, you only have to do 1 consult because I'd like to have pictures on, right? So we're reducing that. But I'm sure we're going to have practices who are going to say, oh, I don't know, I'm not comfortable having my patients do consults. Now, you can turn that feature off, right? Or I want to give an incentive only when they do a consult. Or I want to give an additional incentive when they do a consult. That can
Yeah.
work too.
Yeah, you can almost have some kind of trigger where if someone does respond to a query from a prospective patient, if I'm a patient who's had a good experience with you and my name is out there with a good review and somebody reaches out to me, I'm sure there's a way for you to be notified when I reply.
Correct.
And
I
you
do.
can kind of shower those people with goodness, and not I mean just like a Starbucks gift card, saying,
Correct.
hey, we appreciate you continuing to say nice things about us, and we just want you to know we're thinking about you. I think that's a clever way to do it. So we've got 10 folks on the line here today, and a lot of them, all of them, are extremely bright in their own verticals and offering. What questions do you have for Dr. Melki?
Someone challenges me.
Yep.
Mine's more on your My Teams over the review product. how long does it typically take for your my team's group to kind of onboard a practice, develop all the necessary skills in that particular EMR, things like that, just generally speaking?
So generally, from the moment people get onboarded, it takes about 3 weeks to because we recruit staff for them. They interview the staff with us. They pick whoever they want. And the whole idea of my team is that it's your team, meaning you don't have a bunch of people answering for a bunch of practices. You're hiring your own employees with our help, right? And they become yours. And the most successful practices that we have are the ones who are really embedded. When you're like they have a birthday in Kansas and the
Yeah.
people are on Zoom and they're like, right? And that works like really, really well. And so it takes about 3 weeks to do the on between finding the employees and starting training them and all that.
And so
Plus
the
or minus.
practice is the one training them. They're training them on their processes, their systems, their technology stack. What's the typical retention rate for those employees that you're placing with those practices?
Right. So we give a basic training, meaning basic training on phone answering, on ophthalmology or whatever the specialty is, the things that we know. The practice will give them more specific training on okay, this doctor likes this doctor like that, right? And my locations, all these things. Like any employee that they would hire. I mean, there's nothing different than any other employee, right? And and then sorry, the second part of your question was
What their retention rate is, so
right.
that do you find they stay at the practices for a long time?
Right. So the vast majority of these kids are fresh college graduates, okay, who will ultimately go to something else, right? They'll go to either a master's degree or medical school or whatever, right? And what we tell the employees that we want you for a minimum of 1 year. Like, don't join us if you're not joining, if not staying for 1 year. We've been doing this for 3 years, and actually, I'm pleasantly surprised that the vast majority have stayed longer than 1 year.
Hmm.
So in general, the retention is higher than I have in Boston.
Hmm. That's awesome.
Yeah.
I've got a question,
Dylan, yeah.
Dr. Melki. Do you guys have coverage outside of business hours? It came up with the practice that I was talking to today. Okay.
Yeah, no, we don't because we're 7 hours ahead. And it's not
Hmm.
that we cannot do it. I mean, we have practices in California, we have practices in Alaska. So some people can cover after hours, but there isn't enough calls after hours to have
Hmm.
someone who is dedicated to your practice, right? So then I'd have to have someone who can answer for multiple practices, which is not really our model. Our model is to have the employee who's yours, not
Gotcha.
not someone who's sitting there answering for many. And so we toyed with the idea. Some
That
people
makes
have asked
sense.
us, but we don't want to deviate from our core business.
Yeah, and I think they were looking for more of like an on-call
Right,
service, which is a little different.
right.
Thank you.
Sure.
Other questions? Dr. Melki, when will How Did It Go be ready? When will you be commercializing it and really promoting it out in the real world?
So it's ready. Pretty much anybody who's interested can get it. We're giving the premium version for free for 3 months, and people can stick with the free version after that. Um, and I think the free version is really going to be good enough. I mean, for some people, they may want, something more than that. Um, but I'd be interested in what you guys think, because this is something that we've been using. It's been working great for us. But you can get tunnel vision and just think that your product is great. But I'd be interested in what you guys think, looking at it from the outside.
I don't know of anything like this. My team has some crowd attraction. I don't know anything on the samurai side either, but this How Did It Go, I think, is a novel way to attack really any part of the surgical experience. There's a high amount of anxiety that patients have, and it's not clear where they can go for good information. Uh, you know, a, a powerful thing is being able to, if they are confident enough to reach out to ask a former patient about their experience. I think that's really stout. Um, Getting them over the hump. Some folks might want to do that even before becoming a patient, right? So maybe even further back in the pipeline, having a
Correct.
prospect be able to ask, I think, is its own opportunity as well. But I think I haven't seen anything like this in our craft.
So now we have it on our website. So
Hmm.
even patients before they come,
Okay.
right, they can do it. We can even go further and rank it, right? I mean, we can go and rank it on, in our market and have people, go to it. Uh, Interestingly, what we've been doing now is that when people write their review and they share their experience, we've been asking them, have you been on the platform before? Yes or no? And if you have been on the platform, did that influence your choice of moving forward? And if it did it influence what procedure you would have? Right. So we just started doing that like in the last 4 or 5 weeks to ask these questions. And interestingly, a good number of patients will tell you that this influenced their choice. And I think this will give people the comfort to know that this is something that's valuable because they want to know from patients whether this has helped them or not. And uh, so as we go, we're going to collect more and more data from these simple questions, and we will know how much this is useful.
That's great. That's great. Well, thank you for making some time for us today. Kate, you look like you're about to
Yeah, I don't have a product question. I'm fascinated just what drives you, Dr. Melki, physician, still practicing, uh, three other, technology companies. What drives you? What motivates you just to keep building and staying busy and taking courses and all the things?
I think the thing that interests me the most is when I can create something, right?
Mm.
Like I as much as I enjoy seeing patients doing surgery, I always felt that it's when I think of a new way of, taking the cataract out, and I can teach it to someone. If I can think of a different instrument, I feel a level of satisfaction that
Mm.
I don't feel in my usual regular day, right? If I am able to put the lecture together, that's interesting, so, and this is where it's that creativity aspect that really drives me because I enjoy it. It's fun.
Mm.
And sometimes it's costly, but but it's fun. So,
I've paid a
yeah,
few of those along the way myself, so that's awesome. Thanks for sharing that.
curiosity killed the cat. Well, I want to thank you for your time and good luck with your upcoming session. Hopefully, your Harvard business students are as astute as our listeners today. And I know that they will be, but it matters to us that you'd spend some time with us, and you've got busy surgery and clinic and business schedules. So thank you for that. And everybody else, we're on hiatus next week, mostly because I'm going to be in neck deep snow, hopefully, with my family for President's Day break. But then we'll pick up the very next week and we'll circulate the schedule after that and who's coming when. Make sure you're marking your calendar for the Thursday prior to Askers for the Business of Interventional Glaucoma surgery course put on by ASOA. That's going to be a big day and a big session. We already have more registrants than last year, their total attendance. So we're excited for the popularity of that course coming back. With that, have a great rest of your day, everybody. Thank
thank you,
you.
Dan. And if anybody has more questions later or is interested in any of the things I talked about, feel free to reach out. I mean, Matt has my uh, number and everything and my email.
Absolutely. Thank you,
Thank you,
sir.
Matt.